if your doctor told you your cholesterol numbers look perfect, but you still worry about heart disease, what I'm about to share with you could completely change how you view cardiovascular risk. Most people walk out of their doctor's office feeling reassured because their LDL and HDL cholesterol appear normal, but modern science has revealed that these traditional markers are just missing half the story. Hi, Side-Eye Dad here. I'm a holistic health practitioner. And here's what's happening in medical offices across the country every single day. A patient gets their blood work and they see that their LDL cholesterol is like, let's say it's at 120, which falls at within the normal range, more so at the top end. The doctor nods approvingly, says everything looks good, but what neither of them realize is that the person could still be at a significant risk for a heart attack because they're only seeing part of the picture. The problem with LDL cholesterol is that it only measures the amount of cholesterol inside particles, not how many particles are actually floating around in your bloodstream. Think about it this way. Imagine you're looking at traffic on a highway. Traditional cholesterol measures, and it's like counting the total weight of cargo being transported while completely ignoring how many vehicles are on the road. Example of this would be person A has 5 large trucks, each carrying a massive load of cholesterol, whereas person B may have 50 small motorcycles carrying a tiny amount. Both people have identical LDL cholesterol numbers, but person B has 10 times more vehicles that could potentially crash into the arterial walls and cause damage. This fundamental misunderstanding explains why some people with supposedly good cholesterol numbers still develop heart disease, while others with higher cholesterol numbers remain perfectly healthy. Because it's not just about the cholesterol content, it's about the particle count. Every single atherogenic particle in your bloodstream has the potential to attach to your inflamed artery wall and contribute to plaque formation. More particles means more opportunities for damage, regardless of how much cholesterol each particle contains. So this is basic physics and biology, and yet most doctors are still relying on these measurements, and they ignore this critical factor. This is where ApoB comes in. It's a marker that actually counts these dangerous particles. And here's the beautiful simplicity of this test. One ApoB molecule equals one atherogenic particle, and it's that straightforward. So instead of guessing based on the cholesterol content, ApoB tells you exactly how many potentially harmful particles are circulating in your blood. Multiple studies have consistently shown that ApoB predicts cardiovascular risk more accurately than traditional LDL cholesterol, and research published in major medical journals demonstrates that people with elevated ApoB face significantly higher risks of heart attacks and strokes, even when their LDL cholesterol appears normal. This creates a dangerous blind spot in the current medical practice, because you could walk into your doctor's office with LDL cholesterol levels of, let's say, 120, which again is at the more of the top end, but could look perfectly normal on paper to your doctor, and your doctor may even congratulate you on saying, "Hey, yeah, you're at the top end, but you're still within the levels." But if your ApoB is elevated, you could be harboring substantial cardiovascular risk that goes completely undetected. Studies have shown this scenario is like far from rare, and thousands of patients have normal LDL cholesterol but elevated ApoB, which puts them at a higher risk than their traditional cholesterol panel suggests. And this explains these frustrating cases where people follow all the conventional advice and they maintain good cholesterol numbers, they exercise, they eat regularly, but they still suffer unexpected cardiac events. But ApoB isn't the only overlooked major marker. There's still like another crucial test that most people never receive called lipoprotein A, or LPA for short. Unlike other cholesterol markers that could be influenced by diet and lifestyle, LPA is almost entirely determined by your genetics. You inherit LPA from your parents, and those levels remain stable throughout your life regardless of what you eat or how much you exercise. Although I will say there has been recent studies, even one in 2020, that has shown that diet can actually have an impact on LPA levels. And I'll post that in the video here. But high LPA is strongly associated with heart attacks, strokes, aortic stenosis, and research has shown that elevated LPA can increase your cardiovascular risk by up to 400%. So despite this overwhelming evidence, vast majority of people are never even tested for LPA, and many patients only discover that they have dangerous high levels of this after they've suffered a cardiac event. So this represents a massive missed opportunity for prevention. And if somebody knows they have elevated LPA, they can work with their healthcare provider to implement more aggressive reduction risk strategies. They may benefit from specific medications or more intensive monitoring or some functional health practices. But without testing and understanding, this critical information remains hidden. So why aren't doctors routinely ordering these comprehensive tests, you might ask? I don't think it's because physicians are incompetent or that they don't care about their patients. I actually do think that they do. The reality is it's a little bit more complex, and medical education often lags behind scientific advancements by years or even decades. So many doctors learned about cholesterol management using the guidelines established 20 or 30 years ago, and it just takes time for these established practice guidelines to change. And additionally, insurance companies and healthcare systems often dictate which tests are routinely covered and recommended. So traditional cholesterol panels are inexpensive and familiar, while newer markers like Apo B and LPA may require additional authorization or explanation. And let's be honest, in these busy clinicianal practices with limited appointment times, doctors often stick with familiar protocols rather than exploring newer testing options. So I do think, though, overall, the tide is beginning to shift. If you look at some major cardiology organizations in Europe, they've already updated their guidelines to recommend Apo B and LPA testing for improved risk assessment. And I think it's these organizations that are recognizing that traditional cholesterol testing alone is insufficient for accurately evaluating cardiovascular risk in the modern era. So I'll say, if you're serious about understanding your true cardiovascular risk, consider requesting these additional tests during your next visit. ApoB, LPA, triglycerides, and potentially fasting levels, A1C, they give you a better picture than just looking at LDL and HDL alone. And the reason I say A1C is because the root of this, if you look at the root of this problem, from a functional health perspective, cholesterol is actually at the scene of the crime, right? So cholesterol is attaching to the arterial walls because there's arterial sclerosis, which is hardening of the arteries. And so the cholesterol is becoming almost a scab. It would be like you saying that ambulances cause accidents. Ambulances are at almost every car accident, but that doesn't mean that they cause them. So you have to think about it in terms of that lens. So prevention today, it still remains far more effective and less costly than treatment for this disease. But I think overall, people need to understand and test for these advanced markers, and you could work with your healthcare provider to implement these targeted strategies that start to address your individual risk profile rather than relying on these outdated one-size-fits-all approaches. And additionally, I'll end with, functional health practices through diet and exercise can impact your inflammation level and treat the root cause of heart disease. And hint, again, it's not cholesterol. Arteriosclerosis, which is hardening of the artery walls, which is caused by inflammation, is the root of this. So functional health can absolutely help here. Diet and lifestyle factors can absolutely play a part. And I will say, with everything, it starts with small changes. Pay yourself first, PYF, is a financial concept that if you were to take a certain portion of your paycheck and put it away every single month, and it compounds over time in savings or in investments, you'll have a large sum of money over a long period of time. It could create massive impact. That same concept you can bring to health, and by making small changes and implementing different strategies around diet, supplementation, And exercising and just little changes over a long period of time, you can make a massive impact on your health and specifically start to prevent heart disease. So if you like this content, I'd say give it a like and hit that subscribe button. And if there's a topic that you want me to break down, share it in the comments. Thanks for tuning in, and I'll see you on the next video.